My name is Lillian Karani. I was formerly working for Kenya Commercial Bank, where I was employed on 7th December 1992 and retired on medical grounds on 5th November 2021 due to an injury sustained in my course of employment while I was working in Kisumu in the year 2012 when I was attacked by thugs. On that day, that is 21st November 2012, I was working in a United Mall branch where, according to the prudential guidelines of CBK, the branch would close late. It was the only branch working extended hours. And by the duties that I had been assigned, it was my duty to ensure that all the monies of the bank are properly locked. It was also my duty to ensure that all the vouchers or the balancing was accurate, which normally took some time. I left the workplace at around 8:15 p.m. And on my way home, in less than 10 minutes, I was accosted by thugs as I was heading home. There were 4 unknown men to me. 3 of them had machetes. 1 of them had a gun. And they attacked me as I was on my way home, just before I entered my compound, where they hit me on the head after stealing assorted items, among them the bank keys and several of my documents were also stolen in that process of the robbery. I was working at the interest of the bank, not my own interest, and also leaving at that hour. It was because of the work duties that I was doing. The staff then, the unionizable staff, they were being provided transport because they knew the nature of the hours that you are living, unlike me, who was not given transport. So on that day, they were actually transported to their places safely, but me, I had to get my way back. So after I was attacked, I was able to call our staff when I was housed by one of the neighbors, because they could not access my house, who called our head office, informed them, more so for the security of the bank. And the police came much later on at the scene of crime, much later on. I never slept well because I was actually injured. I could not access the hospital at that time. I was very new in that place. I never had any contacts. The policemen never came with a vehicle. They just came walking. And they told me because of the insecurity at that place, they were really overwhelmed. It is in the open domain, in the newspaper for Standard, dated 30th October 2012. There's a whole page that there was insecurity in Kisumu because 29th October, over 500 people, or the residents, had taken to the streets to demonstrate about it. Following there, went to the branch. We were not able to access the branch, and that is back office. I was the only custodian of the key, and it disrupted business. The regional operations manager was informed as per protocol when there's an incident that has happened. And I was given the driver that used to transport the staff, who rushed me to Central Police. We were able to get an OB. And also we are trying to get access to the bank as per the procedure, where we have duplicate keys. And it took time, but my health deteriorated. I was rushed to Aga Khan Kisumu Hospital. And by the time I arrived there, I went into a coma because of the injury that I had sustained. I was admitted in the ICU, Aga Khan, Kisumu, for 5 days. It was decided by my employer, because of my deteriorating health, I was airlifted to Aga Khan University Hospital, Nairobi, that is Parklands, where I was admitted for another 30 days. I was away for over 2 months because of the injury, and it left life-threatening situation to me. Because of my health, I was transferred back to Nairobi. It still went bad, my health continued deteriorating, and also had meetings at the region office, that is Nairobi region, where it was decided again I'd be transferred to near home, that was KCB Sokimau branch, that is near a place I stay. I went to see the director, HR then, because of my health and the work that I was doing. I was requesting to be assigned later duties because the work of a manager operations, who is second in command, and also is in charge of the whole bank operations, we can say is a high risk, especially with ill health. I was able to book an appointment with the then director HR, who is now the CEO, Paul Russo, who gave me an audience, and I was immediately transferred to head office, that is in 2018, after the first quarter. My health continued to deteriorate despite of being in head office, which eventually led to my retirement on medical grounds in November 2021. So the doctor now said the condition could not improve with further medication. I was in touch with the insurance team, the KCB Bank Assurance, and I gave them my claim forms. That was in July 2024, and they accepted them. And they also gave me an acknowledgement email for that, and they started the process of the claiming for disability, because way back in 2014, I had been paid temporarily total disability for the 63 days that I was away from work. And it came from Jubilee Insurance, and it was treated as work-related. When I gave them my forms, it was a back and forth because I could get emails from the person who was handling, who later on told me that the claim had been declined, and they told me that they were appealing. When I asked for the decline document, I was told it's confidential and that I cannot be able to see it. So they wrote to me and told me that they were going to claim for general life assurance for disability, and they'll also claim from group personal accident for the WIBA, that is from Jubilee, and the group life assurance for disability, because I was retired on medical grounds, from APA. So when they wrote to me again, told me that Jubilee declined, they sent me a form. They called me on phone and wrote me an email, told me they are going to claim from APA insurance. When I looked at the form, I called and told them my concern was this was for critical illness, and there were specific illnesses which had been mentioned on that form, and whatever I was suffering from or whatever the injury had caused was not part of it. I was told to add it by hand and have my doctor filled. So I booked an appointment again with the doctor for November 5th, that was 2024. Unfortunately, I was admitted again in ICU. I fell sick due to the same condition that I was suffering from. And eventually it was filled. I gave it to them. And after some time, when I was following up, because I stayed for close to 2 months without any feedback, 2 to 3 months, they told me it had been declined and that there's nothing more they could do. So I asked for a meeting with them. We went and we talked with the person who was handling it at KCB, head office, bank assurance, and he told me that it was a chronic illness, as they put it. So I asked, how come I'm not getting any documentation? You cannot just tell me that the issue has been declined. You tell me you are appealing, and there's nothing that I'm getting to show to that effect. So the lady who was handling it told me, she called me and told me that she had been instructed by HR not to pursue the issue, because when I left in 2021, I had been paid my dues, which did not include for disability. That's when, after talking in the conversation, I never knew about IRA. They are the ones who advised me. Our hands are tied. Why don't you try IRA? Because we are regulated by IRA. That is Insurance Regulatory Authority. That's when I went to them. I gave them my issue. That was now in 2025, February. They acknowledged and gave me the case numbers, because I realized that I never even knew the policies or which insurance the bank had taken for me, because at no time had they even told me about it. So IRA, they did a good job. I was given assigned two ladies. That is, one is Nelly, and the other one was called Isha, and I can't remember the name very well. One was dealing with APA and one was dealing with Jubilee. And they called for a meeting with Jubilee. Jubilee, we had a virtual meeting, and they stated that since they paid the temporary total disability, they said that KCB had not updated them with anything nor gotten back to them. And they also said that they were not aware of any claim from KCB. This is despite of KCB Bank, Kenya Limited, indicating that they had received a decline. And ARA wrote to me on that effect that because KCB had not claimed, there's no way they could compel Jubilee Insurance to pay for a claim that had not been given to them, of which I understood, which made a lot of sense. When we had a meeting with APA, APA was in person. It was held at their offices, ARA offices in Nairobi. And as we are there, they said that they had no problem with the claim, but the policy which KCB had requested for, that is critical illness, was the wrong policy, and ARA, through their writing, also confirmed that because the ARA, they'd asked for the policy, they went through it, and they told me the policy was the wrong one that KCB Bank Assurance had claimed for. They were not supposed to claim from critical illness because I was not covered, the condition was not covered, and so they could not compel APA to pay for a policy that was not, my condition did not fit in or was not in the policy. Of which now again I wrote to the management, that is the managing director of Kenya Commercial Bank, Anastasia Kimutai, and I gave her the findings of ARA. I was concerned because KCB is known to be a reputable bank. Why would they say that they have claimed something which the stakeholders or Jubilee Insurance have said they have never claimed? And I got a writing from IRA, who is a regulatory board, which confirmed that there was no claim from 2014. And there was no even updates, despite of them having medical certificates to that effect. And that's when in September, I got a letter from KCB addressed to Jubilee Insurance, where, one, they admitted had been, they acknowledged that I had been injured in the course of employment. They acknowledged that it was a WIBA case, and this was not a new case because they also wrote the policy number that they were now claiming for disability, which shows, and which also goes to show that what Jubilee were actually saying was true, despite of KCB writing earlier on saying there was a decline. Because if they had actually claimed before, as they were telling me there was a decline, why now write a letter, a fresh letter? That was in September 23rd. The letter is dated 23rd September 2025. And they said that I had actually acquired an occupational disease that was entitled to compensation. When they wrote an email to Jubilee Insurance, I was copied in that email. Jubilee wrote and said they closed my file, they can't reopen. I found it very interesting that how can they close a file while it was still opened and the matter had not been concluded? I have been undergoing treatment for the injury. That's when I also got another email from also somebody from Bank Assurance telling me they have said they can't reopen the file. I was left with a lot of questions. KCB, even in their manager terms of service, they have said that they, and also on the operations manual, that they'll cover the staff because WIBA is mandatory. Yeah, they need to cover the staff against any injury that has happened, occurred during employment. That's when I decided now in October 2025 to go to the Ministry of Labor, DOSH. I presented my case. I was told to put it in writing, and I wrote to them. And I've been going there. I appreciate the support they have given me, of which a letter was done, because when they checked in their portal, they discovered that KCB Bank, Kenya Limited, had not reported the DOSH one, reported in the portal as required. I was given some forms to give KCB to fill, which is mandatory. That is Form 1 and 2. Form 2 is supposed to be filled by the doctor. I wrote to the director HR and gave the forms and requested they be filled. But I don't know that they have been filled, because what I get is that to date they have never filled them. So as per the WIBA clause, it states that an employee or the injured staff can fill the form on their own behalf. So that's what I did. I got the doctor to fill, and I forwarded the forms, that is DOSH 1 and 2. If I'm safeguarding the interest of the bank and their property, what happens to me, an employee who was injured when doing their work? And my question is, again, another one. If WIBA is mandatory, why should they be pursuing what my employer is supposed to do? Because they are the ones who are supposed to go to ARA if they had an issue with the insurer at risk at that time. Because one, they normally take insurance cover for the staff to mitigate on any liquidation that can happen. Is it because I left the workplace? Is it because I'm no longer a staff there? This is not just my story. It's about a story of the employees who are injured during employment, and the employers choose not to follow the law, and also about dignity of a person. When you are being stripped of your dignity by going to the office begging for what is rightfully yours, it is very, very unfair. And also, having worked for 28 years, 10 months, and 29 days, I feel I ought to have been treated better by the employer that I served from my youth and retired medically on medical grounds. I had 10 more years to go. My life has really changed because of that injury. They are aware of it. It is in the open domain. I need a caregiver throughout. I can't be alone. It has really changed my life, and it's a condition that I'll be on medication throughout.